story actually begins when I was diagnosed in 2005 for hepatitis C. And at the time I was going through a very rough patch family-wise. I was going through a messy divorce. So I ended up, because I wasn't feeling well, various aches and pains, and having 5 children, single parent at that time, I actually used to go to the doctor on a regular basis saying, I've got aches and pains, I've got flu-like symptoms, I don't know what's wrong with me, please test me. And this used to be on quite a regular basis, about every 6 months. So he used to turn around and say, there's nothing wrong with you, Miss Begum, you're perfectly fine. Now at the time, I was actually on antidepressants. And he said, you've been on antidepressants for a couple of years, let's take you off them and see how you feel afterwards. I said, all right. So 2 years later, still going back regularly to the doctor, it came to the point that I used to feel, oh my God, he's going to say, Miss Begum, you're back again. So I was actually ashamed of going to the doctor at that point. And I still didn't feel good within myself, so I pestered him. I said, listen, I'm here, please can you test me? Have you tested me for everything? And he said, yes, I have. And he said that what you're suffering is in your head. And I said to him, I said, you know what, it's not in my head. Every hair on my body hurts. I can't explain what it's like. That's all I could do. It's like as if a road roller's been over me and I just ache all over and I can't function, I can't think, I can't do anything that I'm supposed to do on a regular basis. I've got young kids to look after. Please, please, can you test me? So he did all the routine tests and guess what, lo and behold, they all came back negative again. And he said, there's nothing wrong with you. Then I asked the question, is there anything that you haven't tested me for? And he said, he goes, I haven't tested you for hepatitis and I haven't tested you for HIV. And I said, well, why not? It goes, because you belong to a respectable Asian family and I didn't want to offend you. So then I said, listen, I'm very down to earth and practical. I want to know what's wrong with me. And if there is something wrong, I want to cure for it. So I can look after my children. And he said, all right, okay, we'll test you. And then he said, right, do you want the good news or the bad news? And I said, well, give me the good news, so that'll give me the strength to listen to the bad news. He says, well, you haven't got HIV. And at that time, whenever you did 2005, 6, whenever you did Googled something, was it Yahoo at the time or something like that, it used to be people dying in America, and I thought, oh my God, I'm going to die. Who's going to, and it wasn't even me, who's going to look after my children, you know? But when you said you don't have HIV, I just said, thank God, I'm going to live. And he said, hang on, hold your horses. I go, why, what's wrong? He goes, you've got hepatitis. I said, okay. So then it took another 3 weeks to get referred to the hospital. Met this lovely nurse, Siobhan Bahi, and she was absolutely amazing. She was you could say she became my rock. She used to say, can you make a list of questions for the consultant? I go, okay. So I used to walk in, see the consultant, hi, hello, sit down. Within a blink of an eye, I will back out and I still have my list with me. And I used to go to my nurse, he goes, he doesn't even engage with me. He's supposed to be treating me and he's not engaging with me. I don't know what to do. Am I going to survive this? And then bless her, she used to sit down and go through all the questions that I had and give me all the answers and support me. And she said, I think it was second month into treatment, she said, you're coming here on your own. You need family support. And it was interferon that I was on. And I said to her, I go, Shabana, I can't tell my family. And she said, why not? I go, because they are ashamed of me filing for divorce. Luckily, since 2009, I've been employed by the Hep C Trust. I've been able to go into communities, into religious establishments, and I simply say to people, I go, health is first and foremost in any religion you look at. Any religion you look at, that is first and foremost. Why are people not getting themselves tested? So present day, with my post, I have been up, because it's national, I have been up and down the country like a yo-yo for the past 12 years. And we have covered mailers, we have covered mosques, temples, you know, anywhere, community centres, anywhere I can get into, I will go and raise awareness and promote testing. And actually now we've got another peer lead as well, so I'm not on my own any longer. I've been on my own for a very long time. So we've got a colleague, and now we're actually in the process of engaging with people that are in the community. Even now, people don't want to talk about hepatitis C. People I have handheld through treatment within the South Asian community don't want to show their face, or have not told their partners, have not told family members that they've suffered from hepatitis, because it's still a stigma with them. So what I'm looking for is people that are already working in community settings, training them up as peers, so they can promote awareness within their organisations, like a one-stop shop for hepatitis C itself. Any questions, please approach me later. I think my time is up.